In this video, I had an opportunity to talk to a medical massage therapist from Oklahoma about their client's shoulder and neck pain. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthy and help more people get out of pain. I got to do another provider case breakdown. I really enjoy doing these. And this week, I had Sarah reach out to me from Oklahoma with a client that had been diagnosed with a shoulder problem, also having neck issues, pain down the arm, and even had an MRI done, trying to figure out exactly what's going on. So in this breakdown, we go through and ask all the important questions of figuring out exactly what's going on, getting to the root cause of what's going on, making sure you're asking the correct questions because you can't fix a problem if you don't know what it is in the first place. Then getting to what's called a tissue-specific diagnosis list and knowing exactly where the problem is and what you can do to help. Also clearing up some misconceptions that problems are only soft tissue based and understanding that there can be problems in the joints, the tendons, the cartilage, and the disc as well. And then lastly, what we end up doing is talking about what we found on the MRI. So I'm going to link up that video now and hope you can get something out of watching it.
All right, I got Sarah here from Oklahoma, correct?
Yep, that's correct.
Tell me a little bit about yourself.
So I'm a licensed massage therapist. I've been in this industry for close to 5 years. My specialty is medical massage therapy. I've worked with patients for rehabilitative care for close to 3 years. That's my son, sorry. And I'm studying to get my bachelor's of psychology and then eventually my doctorate. So
okay.
That's
all. I have my undergrad in psychology, and I'm amazed at how much I actually use it in practice. Just like kind of dealing with people. It goes well. So Sarah reached out because she has a client that's struggling with like a neck, shoulder, arm type of thing, and there was an MRI done as well. What we're going to do is at the end of this video, I'm going to go back in and review the MRI and then add it on there. So let's just start off right away. So how old is the person that we're dealing with?
So she is 52.
52. And where would they say they feel most of the pain?
So most of the pain is in their left shoulder,
Okay.
right in that joint, in the left shoulder joint.
So when you say shoulder, is it like more here or more here?
Sorry, the video is freezing up a little bit.
That's okay. Is it more in the front part here or more off to the side or more back through here?
So it is more out to the side.
And how would they describe that pain? Is it like sharp, dull, aching, throbbing, stabbing, numb, tingling, burning?
So it's a very sharp pain and it kind of lingers.
Okay. And then a scale of like 0 to 10, 0, no pain, 10, they wouldn't care if we just cut it off. Like, what's the worst that pain's gotten?
So she says it's at a 6 right now.
Okay. Has she ever had anything higher than a 6? Like a 8 or 9 or 10?
She's woken up and she says the pain at that time is probably like a 7.5.
Okay. And then what would you say it's been on average over the last like 30 days or so?
So it's been at a level, she says a level 5.5 most of the time, but it's now progressed to a 6.
Okay. How long has it been going on for?
So it's been going on for 6 weeks now.
Okay. And then what can really flare it up? Like what type of movements, activities, work, like what can really flare it up?
So sleeping, she'll wake up and she'll have sharp pains if she sleeps on her side. Okay. And if she tries to lift her arm away from her, she says she can only lift it so far and then it'll start hurting. But once she puts it back down, it kind of subsides.
Okay. And then is there anything when it does get bad she can do to help it feel just a little bit better?
So she says all she can do is just sit down and just try to breathe through the pain.
Okay. And then is there any history of accidents or trauma to that area?
She was lifting a potted plant and she lifted wrong. And then she felt something kind of pull there. And that's whenever she started having the pains.
Okay. And then there was imaging done. They did an MRI. What did they do an MRI of?
They did an MRI of her shoulder joint, of the left shoulder joint.
Okay. Who else has she seen for this problem?
She has seen, one moment, let me pull it up. She's seen a medical doctor. She's seen a orthopedics specialist and a DO.
What did any of them tell her was wrong?
So they said that she had a torn rotator cuff.
Okay.
And that's why they that's why they recommended the MRI.
Okay.
So that's all that I know so far. She didn't go into any other details.
Did they do any treatment? Like, did she get an injection? Did they put her on any pain medications? There was no like PT or anything like that either, right?
Right. Yeah. They wanted her to do physical therapy, but she wanted to see what I would recommend first because she believes in massage therapy. And they suggested surgery. And I told her, no, we're not going to do surgery right now, right away. I said, that's a last resort. She said that they also considered stem cell injections for stem cell
actually I have a video coming out Saturday about why stem cells are actually bullshit. Like I went through that because I get that all the time from clients where they're like, oh, I'm just going to get these stem cells. And I'm like, okay, and then what else are you going to do? And people think they can get these magic injections and stem cells and not do any of the work and then miraculously feel better. So she's at least smart on this side and understands that like surgery should always be your last option instead of like your first option. Have you done any tissue work on her since she's been injured?
I have not. No, she lives 2 hours from me. She's actually going to come up here Friday and stay with me for about 6 or 8 weeks so we can start therapy.
Okay. And now does she like to do any like exercising or working out?
She does not. She can walk, but she doesn't really know how to do proper workouts.
And then what does she do for work?
So she's a cosmetologist. So she does hair.
How long has she been doing that?
She's been doing that for close to 15 years now.
Okay. What did she do before cosmetology?
She was a professional dancer.
Okay. So yeah, definitely that puts a lot of wear and tear on the body. Let me think here. And then how is it affecting her quality of life?
So it's interrupting her sleep patterns. So when she wakes up in the morning, she feels very exhausted. She also has to nap through the day.
Okay. So I got all the information. What do you think's wrong?
So I think she just pulled a muscle, honestly. I think she pulled something, and I don't think it's as serious as the doctors are making out to be.
Okay.
She visited last weekend, and when I felt the area, there wasn't like extreme amounts of heat. So there's not a lot of inflammation in there. So I think that it's minor. Honestly, I think it's minor. Okay.
So I'm going to push you a little bit there and challenge you just a little bit. What could lead us to think that it's actually serious?
If she's in constant pain, if she's crying in distress, she couldn't be able to do much. Like she couldn't lift like a simple water bottle, and she can lift a water bottle.
Yeah.
I think that the arm would practically be, useless if it was so extreme.
Yeah. And I think what happens as practitioners, we get stuck in what I call no man's land or no woman's land. Is one side, we think it's like just soft tissue, a simple muscle pull. And then the other side, the surgeons are like, well, you just need full blown surgery because everything's torn up. It's somewhere in the middle. I don't think it's just a simple muscle pull for a couple reasons. Number one is the severity of that. Like if I'm hearing someone that gets to like a 6 or 7 out of 8 and they're living in a 5 or 6 and then movement feels worse and it's better when they rest, then I'm just looking at her history, being a dancer, then being a Cosmo, like in these weird positions for so long. Plus your age too. When you get, up into your 40s and 50s, like degeneration becomes more of a component in there as well. Yeah, I mean, I definitely think there's a couple of components to it. So let's go through the list. So I have the list and I talk about that. And if you're watching this on YouTube, what I'll do is I'll link up the 7 problems. I always try to point. I'll link up the 7 problems up here of what they potentially could be. Do you know what they are? What 7 potential problems are?
I do not yet. No, I don't.
So we can have a bone problem. We can have a cartilage problem. We can have a disc problem. We can have a ligament problem. We can have a nerve problem. We can have a soft tissue problem. And then we can have a tendon problem. So let's take her through this. So bone. Now, yeah, bone could be an issue there, especially a little bit older from where we see, especially that symptom location in the front and the side there. A big factor for me with a bone issue is definitely going to be a history of a lot of trauma. Like maybe they fell a bunch of times, maybe they got in a car accident. I tend to see this in like athletes that played like contact sports and things like that. So bone's not high on my list, but it's there just in case. Next one's going to be cartilage. This one screams cartilage damage to me, specifically to the labrum in the shoulder. So the labrum basically goes between your upper arm and then to your scapula, and it's like a cushion that builds up in there. And over time, what happens is with bad mechanics, overuse, history of dancing, Cosmo, all that stuff, not a lot of like working out and doing stuff like that, the muscles can't do what they need to do. So it puts more pressure on your shoulder. So normally your shoulder just wants to open up nice and free. When that can't happen and it works around it, it kind of jams itself in there like that. And then it actually starts to fray the cartilage. When the cartilage gets frayed, they develop these things called flap tears, which is basically damage to the labrum in the shoulder. And labrum presents just exactly like you're saying there. Hurts to lay on it. Definitely can get some pain in the front of the shoulder, side of the shoulder. Labrum usually hurts when you're extending it and you're using it. It feels better with rest. Another thing they might note is like some popping or clicking, or they might get like a really sharp pain if they reach, like I see this a lot, especially in females, if they reach back to like put their seatbelt on, or if they're like putting their bra on, they might feel that. So this is definitely labrum's high on my list. The problem with a labrum is it doesn't always show up on an MRI because they don't order the right type of MRI. You need a special one with like injection and all that. And usually we see that. So cartilage, disc, this doesn't sound like a disc problem for me. Usually a disc problem is going to be like pain deep in the back part of the neck and more like sharp, numb, tingling, things like that. That doesn't look like a neck problem to me, especially with that symptom location. Disc, ligament. Yeah, ligament for sure. There's ligaments in the shoulder, like what's called the posterior capsule of the shoulder. Usually that's going to present with like tight, weak, limited range of motion, pain like that. So that I kind of put like ligament and soft tissue together, but I separate them out for that. Nerve, next one's going to be nerve. You can get nerve entrapment in different areas, especially on the front part here. Where the scalenes come and they form like the nerve roots. So there could be a nerve entrapment there. A lot of times they'll get like some numbness and tingling down into the arm, into the hand. Then there can also be a median nerve, ulnar nerve, or radial nerve entrapment on the subscap in there as well. For sure, soft tissue. Yeah, soft tissue. Everything here, there's definitely a soft tissue component to it. Soft tissue makes the muscle weaker, less flexible. It's like glue that gets inside there. Usually these problems start as a soft tissue component and then they manifest to that part as well. Most common cause of decreased flexibility, pain, and weakness. And usually it starts in the muscles and around the nerve and around the ligaments. And then what happens is then it starts to put more pressure on the bone, cartilage, and then the tendon. Tendon's high there on my list too, just because of the symptom location. I'm sure she does have some partial tearing of the rotator cuff muscle, because what happens is when the tissue can't lengthen and stretch how it's supposed to because it has scar tissue in there, it puts more pressure on the tendon, and then the tendon starts to get beat up, and that's when you start to get like partial tears and things like that. So the way the surgeons are looking at it is they're looking at it as the effect instead of the cause. So they're like, oh, I'm sure she has some tearing of, but a lot of people are walking around with partial tears in the rotator cuff. And the fact that she didn't have any real trauma with that, surgery is not going to be as big of a slam dunk for that. Whenever I see like no trauma, I'm thinking a lot of compensation, a lot going on in there. So if I had to list it, I'd put 1A, 1B, it would be soft tissue problem, and then cartilage problem. And then my 2 would be potentially a tendon problem in there as well. So you're not going to see as much inflammation show up as it gets more chronic, especially with the labrum. Like you said, it doesn't feel like it's hot or whatever, hot or warm. You're going to see that more in the acute phase. Now she's like 6-8 weeks out. You're going to be more in that chronic phase in there. So I talked a lot. Questions? Does it make sense where I'm going?
It makes a little sense. I haven't thought about that way. You know, as a massage therapist, we just really focus on the muscles.
Yeah. And I talk about this all the time. It's like, just because you're not allowed to legally diagnose doesn't mean you can ignore the other problems. So the best analogy that I give for this, and I give it to my patients as well in my own clinic, I'm like, think of your cartilage and your tendons as like your thumb, right? And it's stuck inside a car door. The car door is all that scar tissue. So, and all that adhesion that builds up in the muscle. You can't give this a chance to heal until you free that up. So in this case, what really needs to be done is, I'll send you a couple tests when we get done. I'll email them over. But the first test I look at is what's called the shoulder abduction test. And that really gives me an idea. A lot of times if there's a labrum problem in there, they can get to like here, then they get like a little hitch. They're like, oh, that doesn't feel good. And then they can finish it off again and it's okay. And then when they drop it, it gets caught again and they go from there. So my first step is really just to clean up the rotator cuff. And I consider 3 muscles in the rotator cuff. What I go after first is I do a lot of work in like infraspinatus teres minor, because that's the biggest mover of the shoulder itself, and it tends to get the most scar tissue, and it's the easiest to get to because it's on the back part of the shoulder. I think I share that one in my free training module of how to treat that area. Then I treat the posterior capsule, which is off the side. It's between the delt and the tricep. That's where it's more of that ligament. And I would say I do about 90% of my shoulder work on infra, teres, and capsule. And then the last 10% is just like a subscap cleanup. Most people like to go after subscap first, but I don't see it as a big of an issue, especially with no trauma, because the subscap gets such a huge blood supply. It's not going to get as much scar tissue in there. From there, then restoring range of motion, then building the strength. So what she needs is someone like you first to clean up those motions. And to that, then I think physical therapy would help to go in there and kind of restore some of that range of motion. But you got to start with the tissue cleanup first. We, as a soft tissue people, we need to be the first people we see. Like, I've been accused of being very anti-physical therapy. I'm definitely anti-chiropractic, but I'm not anti-PT. I'm just anti, like, when it comes in. It shouldn't be the first thing you see. It should be like the third thing you see. So it's like, my first goal is like, think of this as like the injury is like a bad house and we got to tear down everything. We're the people that go in and tear it down. Then we put the foundation, then the siding, and then the physical therapy is like the roof on the house. So you wouldn't put a roof on a house before you lay down the foundation. So yeah, I think it's more, I think it's not just simply, and that's what I want you to get in a better idea of, like, thinking more critically and not looking at it with like just blinders on, be like, well, it's got to be soft tissue. Like, well, of course it is, but there's other components in there as well from there. But yeah, this screams, I'll get a peek at the MRI and see, but this screams like cartilage damage to me, just with all I've seen them so much, especially her age and what she's done.
Okay.
Questions?
So where does cupping fit into this? Do you do cupping in your practice?
No, I don't.
No cupping?
Do you want to hear why?
Why?
Usually I get people triggered when I say anything bad about cupping. I don't believe cupping is an actual treatment. I think it is a maintenance. And there's a big difference between treatment and maintenance. So this is my best analogy that I give. Think of this like problem as like a really bad cavity that needs to be drilled out, and it needs an expert, a soft tissue specialist that's like you, that needs to go in there and drill it out, get that cavity out, get all that moving in the right place. Cupping, to me, is kind of like getting a clean or brushing and flossing. Like, it's important, but would you go into a cavity or a really bad root canal and start brushing and flossing it and getting a deep clean on it?
No.
No. So you have to decide, and this is the best analogy I give. There's two types of practitioners out there. And I love the dental analogy. You're either the dentist or you're the hygienist. And when you're the dentist, you get paid to fix things. You get paid to fix the result. And you don't get paid based off your time. They don't go, hey, Sarah, we had 45 minutes scheduled for this drilling, but it only took you 15. I'm going to need you to spend another 30 minutes in there and really make me feel like crap. No, they're just happy their problem's fixed. Now, hygienists, they're important, but they really get paid pretty much similar to everyone else out there. Like, there's no one that's doing like you might be able to charge a little bit more for cupping or stretching or all that, but the difference between a really good dentist versus a really good hygienist is totally different. And that's what I want people like you to be, is the dentist in there. So I don't think cupping is bad. I don't. I just, it's not a treatment for me. The idea of a treatment is getting rid of one of those pathologies in there. And like I said, cupping is like brushing your teeth, and it's very important, but you wouldn't try to fix the cavity by brushing and flossing it.
Right. So I saw in one of your videos you did scraping.
Yeah, you're triggering me. No, I'm just kidding. Get out of that. My biggest thing I'm trying to teach massage therapists is like, be more like precise with what you say and what you do. Like, it isn't scraping. Scraping reminds me of like some jackass that's just like beating the shit out of somebody's muscles and like causing bruising. Like, anyone can do that. What we do is we do an instrument-based treatment, which is very focused and very precise. I actually have one right here, and it's very simple. And a lot of people are like, well, that looks simple, but it actually works in the right way, because it's getting there. And what happens is I think the instrument is more like a scalpel, as opposed to like a probe. And too many people use it as a scalpel, and they beat it up. So I use the instrument for certain areas. I use it a lot along the spinal ligaments, like nuchal, interspinous, supraspinous. I do a lot in the fascia, in the low back. It does really good in the elbow and the arm. There's certain rules that we see. I have a whole video about like when to use the instrument and when not to use the instrument. But at the end of the day, your hands are going to be the best thing for it. But don't say scraping, because scraping reminds me of just a jackass doing stuff like that. So
okay.
So yeah, all that, like, cupping is fine on the back end, but I look at this as like, you're better than that. Like, I don't, like, people get mad at me and they're like, well, you don't know the benefits of, like, sure, there's great benefits to doing it, but it's not what they need at that time. And that's the problem, is everyone wants to be the hero in the whole journey. Like, they want to be able to do it all. I'm like, hey, we're just building a house and I'm just the first person that you see, but I'm important because I'm laying the foundation now. And then on to the next person. So most of your work for the shoulder, I love the shoulder because they're easy structures to get to. They're big muscles and you can feel a lot, and you're going to increase that range of motion a lot. So good question.
All right.
What other questions?
So when she comes up here, we're going to be going to the Y a lot. Would you recommend her swimming? Is swimming okay?
Not yet. Swimming, it puts a lot on there. So I always talk about, there's like an order of operations to fixing a problem. Number one is you just got to restore range of motion. That's the first spot. then you need to balance strength, because a lot of times what happens is when there's a lot of scar tissue that accumulates, that muscle gets weak. That's when I do like my corrective. Then the last one is increase overall strength. That's when we do more global motions and stuff like that. Swimming is going to put a lot of pressure on that. So what I like for people to do is the first 2 weeks that I treated, I either just have them ride a bike or walk, because I don't want any extra factors in there as we go. And I want to, basically the way my system works is very objective. So the test determine where we're at. So for a healthy shoulder, I want them to be able to come up just like this and their biceps can touch their ears. And that comes from cleaning up that. And sometimes we won't get all of that. And the rest that's left in there is that degeneration to the tendon, to the cartilage. But then the client will be like, well, when can I get back to working out? And I'll be like, hey, great question. I'm glad you asked. When you can do this. And they're like, okay. So it gives them like real goals to work towards instead of just like, hey, how do you feel? Because anyone can make you feel better temporarily, but very few are improving the function. You got to get them to move better from where they are. But yeah, she just needs some really focused work on the rotator cuff, the capsule, all that, and then see where you're at. And then once I clean up that area, I tend to do a lot of work in the upper thoracic, lower cervical area, especially like from like C6 to like T4. I work like the interspinous ligament. I work the accessory nerve, the erectors, because that area is a really big problem. Especially, usually what I find is like most problems start with like a thoracic spine compensation, and then the shoulder goes from there. So I end up doing more work. Shoulder cleans up quick, but I end up doing more work on the T-spine than anything, because everybody's spending their life in these really bad postures. So yeah, it's like your goal and your whole idea is, what can I treat that's going to be the most effective, the safest, and most durable? And what I find is that massage therapists want to do so much treatment instead of the right treatment. I would say treatment's like a medication. We can give you enough to be effective, but we can overdo it as well. And they tend to do overdo. So I'm like, hey, do a 15 or 20 minute session, get them 5 or 7% better, give them a few days to come back, recheck their test. If their tests are doing good, we're doing really good. So if I add 8 to 10 visits over a couple weeks, I'm 40, 50% better. But what happens is people push it, and then they'll be like, all right, I did all this muscle work. Now I'm going to cup it. Then I might do some exercise and I'll do that. And it's just diminished gains. And you actually can make them worse from where they are.
Okay.
All right.
All right.
So yeah, that sounds really good. It looks like I got time left. I thought I was running out of time. We still got 10 minutes left.
Okay.
Any other questions for me?
So whenever I do the treatment, you were talking about spacing it out. How many days should I space it out?
I like to go twice a week for about 3 to 4 weeks. And I want at least 24 hours in between treatment. If she's coming specifically to work with you and is in town for a short amount of time, and I have people like that, I go 3 times a week, and I just have as long as I have 24 hours in between for that. Okay. And normally what I would do for someone like that would be maybe treat the shoulder on, like if we're like looking at 3 visits in a week, I would treat the shoulder on visit 1, and then middle of the week I would treat the T-spine, and then treat the shoulder again on the 3rd visit to kind of give it some time as we go.
Okay.
But normally I go twice a week for about 3 to 4 weeks. And the tests really determine where I'm at. But what I end up seeing is that way more work is done in the thoracic spine than ever in the shoulder, especially with no history of trauma.
Okay. All right.
Any other questions?
She will probably ask me about diet restrictions, but I know that's not your area. So
I talk about all the time, like, just don't eat shit. Like, you're an adult, like, don't eat shit. Like, and they're like, ooh, they have to. I'm like, you're a human, you're an adult, drink water, go for a walk. And they're like, oh, what do I want to do? I'm like, well, then I don't know what to tell you. Like, don't eat shit. Don't put shit in your mouth. You're not 10.
Right.
So yeah, I'd be like, do you want this, you want it fixed quicker, or you want it, because inflammation is a big thing and food is a big thing, but that's not my realm. But I'll note it. Like, if I got someone that's like way overweight, they smoke, they drink, I'm like, hey, ma'am or sir, like, this is going to take longer. They're like, ooh. And they're like, well, what do you mean? I'm like, well, look at you. And that's what I think for people, it's like just being honest with those people. I'm like, I used to kind of skirt around it, and I'd be like, oh, well, no, you're unhealthy. It's okay, but it's going to take longer as we go. So yeah, good questions. Any other questions?
None that I can think of. You answered
Thanks
them.
for bringing.
Pretty good.
Thanks for bringing this. It was awesome.
Well, I hope that video was insightful. Maybe you learned something, got a different perspective about the idea of being a clinician first, then a technician. After we got off the phone, I had a chance to go through and review the images in the MRI, and I did see some damage in there to the tendons, to the cartilage, and the joint as well. Nothing crazy, nothing that warranted surgery, but lets us get a better idea that we need to clean up all that soft tissue first to get the pressure off of that degeneration cartilage and all the problems that are in the joint as well. This person does not need surgery, they need soft tissue treatment first. So a couple take homes from the video. Number one is you got to think critically, like get in the idea of like actually solving problems and figuring it out. Don't just want to jump into treatment right away, get your hands on someone and not really know what's going on. That's when you get stuck in what I call winging it. And when you're winging it, you don't have a plan, you don't know what really works, and you just throw a bunch of shit at it and try to see what happens. Next thing, stop trying to look for the one thing for causes of an injury and having this whole idea that it's going to be just that one thing. It's got to be this muscle, it's got to be this tendon, it's got to be this. It's a combination of things, and understand that it's a multifaceted approach. Number three, understand that you can be a better option than physical therapy and the chiropractor, but you got to get better at your skills, and you got to start thinking critically and being that clinician and not jumping to want to do treatment right away, slowing down, getting the data, doing tests, palpating, and being so damn good that those other practitioners can't even hold a candle to you. That's all I got for the video. If you want to reach out and want to do one of these provider consultations, these are awesome. I don't charge at all. All I ask in return is you allow me to record it and share it with other people for educational purposes. Go grab our free training. We just revamped it, got a lot of good information in there about critical thinking and figuring out problems and solving problems, so you're providing solutions for people. We just got all our online CU courses approved as well. You can reach out and take those if you want. And lastly, go out there and be great this week. It's the only thing that truly pays. See you guys on the next one. Bye.